Hello and welcome to The Art of Being. I'm Anshli Gadvi. Today we're going to be exploring homeopathy, a holistic system of medicine that claims to treat a range of illnesses. In addition, we'll also be exploring a relatively new term, Bowen therapy, a holistic treatment as well that is used to treat pain. We're going to be speaking to Amit Agarwal, who is a Bowen therapist and also a naturopathic doctor. So, what is homeopathy all about?
Homeopathy is a system of medicine that's World Health Organization approved, that is gaining popularity around the world. It actually involves diluting substances from nature repetitively and shaking it in a special way called potentization, which renders the remedy, the final remedy, in a state capable of stimulating the body to heal from within. And that's what makes it so popular, is that it is actually initiating cure from within the body rather than just suppressing symptoms of a disease.
And who discovered homeopathy and how, it's come to evolve to this point?
Who discovered homeopathy was a man named Dr. Samuel Hahnemann. He was a doctor as well. However, he changed the principles of how medicine was to be practiced, noticing that by using minute amounts of a substance, people were able to create an effect within the body that initiated more long-term cure, because you're actually stimulating the body's force to take over the healing. And that's what he discovered, Dr. Samuel Hahnemann.
Homeopathy work in conjunction with modern treatment, or is it, can you just define it and say this is holistic?
I like to call this sort of medicine integrated medicine, because homeopathy does work well with regular medicine. In fact, homeopathic doctors are trained in a lot of scientific principles and protocols, including pathology, clinical diagnosis. Some are even trained in pharmacology.
Yeah.
And a lot of doctors in Australia and India are now being trained in homeopathy in conjunction with their regular medical program.
How long does it take for one to really see the effects of the homeopathic medicine?
With homeopathy, it can take anywhere from half an hour to months, depending on the condition you're treating.
Okay.
If you have a cold, you come in within half an hour, that cold can be alleviated, okay, and then you continue your dosing. If you have chronic problems, then, or a problem that's been there for a long time, of course it will take a bit longer for the body to get better.
Okay.
You know, and depending on how you dose the medicine, it can take better.
What other conditions do you find that homeopathic sort of covers?
Homeopathy covers a wide range of symptoms, from chronic disease to acute. You know, migraines to infertility to menstrual cramps. Certain cancers as well respond quite well to homeopathy. Anything chronic, anything acute, you know, you have to also use your judgment and say what's appropriate right now and when's it appropriate for referral. And that's what we do. That's why we refer to doctors when necessary as well. And we work as a team. We prefer to work as a team because that's the beauty of integrated medicine, is about allowing the patient the option that best works for them.
Right, right. I'd like to get into what other factors do you sort of look into before saying this is what you need, this particular medicine is what will help you? Is it the appearance? Is it, you know, diet? What do you take into consideration?
Good question, Anjali. In homeopathic prescribing, we look at the whole person, because it's such individualized treatment. A headache in one person does not manifest the same as a headache in another. Even when you get a headache, yours might be more right-sided. Another person's might be only in the evenings, right? So we look at the characteristic nature of the symptoms. We also look at the character of the person. For example, we look at the foods that they like, you know, the fears or the mentality of the person. because all those contribute to the person's character and individuality. And therefore, that is why homeopathy works so well, because it is individualized treatment. We're treating the person, not so much only the disease.
Right, right. How popular is homeopathy here?
It's immensely popular. It's gaining popularity not only here but around the world. Like, to repeat myself, doctors in Australia and India and in Europe as well are starting to learn homeopathic medicine. Right. In rural communities it's working great, right, because it's affordable. Okay, I take it out into remote villages in northern Kenya. I do some charity work as well in the north, and the response is great. You know, it's getting a lot of popularity.
That's great. And one would obviously want to know, for instance, if I have a condition, I'm already on conventional medicine.
Yes.
Am I supposed to stop what I'm taking in order to start the treatment of homeopathy? Can these two be integrated?
You don't have to stop your medication. Okay, the two can be integrated, to answer your question, and we prefer working together with your regular doctor to find out the best option for you. And when you see a positive and a long-term response with homeopathy, then you can talk with your regular doctor and ask them about dose reduction or managing your symptoms differently. And that's why I encourage doctors to work together, because we need to come together and integrate this form of medicine so that patients receive the best options for them. Yeah, both are important. Both are really important.
Absolutely. Does it have any side effects?
I wouldn't say homeopathy has side effects because it's your body doing the healing. I'm not using any chemical because it's really diluted. What people might call a side effect is what we call a healing response. For example, if you had a lot of acne as a child and that got suppressed, and later on you developed asthma, for example, in your adult years, and we're treating the asthma, what might happen is, as the asthma is getting cured, right, because the acne was also there in the past, that might flare up. However, the flare-up is very temporary, and it's not permanent, and that's a healing crisis, what we call. And that's actually a positive response, because it's showing that the body is actually going back to a state of where it was interfered with.
Okay. And what would you like to tell our viewers today regarding homeopathy?
Well, I would encourage viewers to investigate the treatment options you have out there, be well informed about your disease, the diseases out there, and that learn to integrate homeopathy with regular medicine. I would encourage patients to do their research and give it a try, and also inform your regular doctor of what you're doing so that the two can work hand in hand.
Okay. Great speaking to you today, Amit.
Thank you, Anjali.
All right. Well, we've been speaking to Amit Agarwal, who's a homeopathic doctor and also a Bowen therapist. I'm Anjali Gadvi. Thank you for watching The Art of Being, and we'll do it same time next week. Bye-bye.